A bit on overdose prevention via naloxone, and this is just a program that is quite successful in the U.S. It's out of North Carolina. It's called Project Lazarus. They're involved in community, and they're involved at Fort Bragg, the U.S.'s largest military base, and they're showing exceptional results by providing overdose type information. And then providing naloxone in two different ways. First, through take-home naloxone programs, where if I was at risk of overdosing, I might go to a health practitioner or someone else and ask and obtain a naloxone kit. The second way is through co-prescribing. So if I go to my physician and he gives me or she gives me an opioid prescription, then co-prescribed with that would be naloxone. But you can see the results are just, I mean, they're astounding, down 69% in a 2-year period. So the website's at the bottom. I encourage you to check it out for more information. And we have a great outfit out of British Columbia. It's called Toward the Heart. This is the front page of their website. You can find them on the web, but it's a treasure trove of fantastic information. I mentioned last week that the Canada Centre on Substance Abuse released their report. It's really a fantastic panel. It's a good report for a whole bunch of reasons. Some suggest it doesn't go far enough, but I mean, at the end of the day, they report to the federal government, and they're relying really on communities at all scales and all levels, sectors right across the board to get busy with implementation. In that report, recommendation number 8 speaks to naloxone. It's, I think, the only one in the report. It says, and I quote, to review existing evidence and or conduct objective and independent research and make recommendations on the effectiveness, including the cost effectiveness of community-based prevention initiatives designed to reduce overdose and related deaths. For example, take-home naloxone programs. The proposed leads is Health Canada and other research organizations. For those of you who have been paying attention to the rising number of tombstones in Canada and the U.S. and elsewhere, and paying attention to overdose prevention initiatives, I suggest to you, as you probably already know, that the evidence was in a long time ago about the effectiveness of naloxone. So I'll just highlight it really quickly. First of all, look to the World Health Organization and their essential model medicine list, which lists the most efficacious, safe, and cost-effective medicines on the planet, and naloxone is there on page 3. Secondly, in the USA, if you're looking for support, evidence-based support, then you could hardly do any better than the kinds of organizations that are supporting naloxone, such as the American Medical Association, the American Public Health Association, the National Institute on Drug Abuse, the Office of National Drug Control Policy, which is the executive branch of the President, the U.S. Society of Drug Diverters, and the Center for Disease Control. I could go on, but suggest to you that the evidence is in the U.S. Of course, is considering over-the-counter naloxone as an option, meaning that you could walk into a pharmacy and pick it up over the counter without a prescription, much like you can do, at least in Ontario, for an EpiPen right now. So a body of evidence, and we have a recommendation. We'll see what Health Canada does. I think the Minister's general response was to proceed on a go-forward basis. So we'll see what happens with the 2 recommendations out of our council. Anyway, that's the barriers report in a snapshot. I would like to open it up now to questions. Anthony and Kayla are in the room with me, and they're much smarter than I am and happy to answer any questions you might have.
Thanks, Michael. It's Tim. If you have a question for any of the presenters today, if you look on your attendee box on the right-hand side of your screen, you'll see that you can raise your hand. And if you want to do that, and if in fact you have a mic, we will unmute you and you'll be able to ask questions to the presenters. If you don't have a mic, if you simply type your question into the question box, we'll be able to see it there and read that on your behalf. So we'll open up to questions through either the question area or by raising your hand. While we're waiting for some questions, Michael, if I may, or perhaps it's Anthony or any of our presenters, when the subcommittee was struck to look at the recommendations and the routine non-response was suggested, can you tell me more about what your thinking was around that, and how receptive you think local police might be to that suggestion, or something to that effect?
I'm sorry, which suggestion, Kim?
The routine non-response by police.
Oh, the routine non-response. Yeah, we hashed it out. Part of the thinking was it's something that you can do locally. You don't have to ask permission from anybody to implement that, but it's certainly at the discretion of the local community. But having said that, it's also a jurisdictional nightmare, and I don't work for Waterloo Region Police Services, but I think some of the concerns would include those situations where perhaps there really is a crime going on. Police are investigators; that's their job to enforce the law and to investigate. So of course they're interested in attending such events, because every now and then it's a minority, I would think, but the victim is of the overdose is also the victim of a crime. We also have issues that come into play around workplace safety, workplace health, all sorts of statutes to ensure a safe environment, and rightly or wrongly, probably a mix. Other first responders feel much safer going into an overdose emergency, knowing that the police are there to sort of have their back. Police are often the first on the scene, and they can provide at least preliminary medical attention. And then furthermore, other statutes related to child welfare that were raised by not just the legislation, but by our local police force. So a whole bunch of reasons for going the route that the committee did, but those are some of them why routine non-attendance did not happen. Something we didn't discuss in our report because to our knowledge it just doesn't exist, but it is possible that you could have police still attend and lay charges, and for fairly minor charges it's quite possible that the Crown does not proceed with those charges, providing a different sort of form of immunity. But it's not something we explored in great detail at our committee. It was an ad hoc, and we landed with Good Samaritan legislation. Just on a side note, I think most of the U.S. legislation includes, it doesn't provide immunity for breaches of probation and parole, which is, if you look at the data set that in the barriers report, would be a bit of a cause for concern around federal Good Samaritan legislation in Canada. But we'll see what happens. I mean, it's not on the radar of our federal government currently. I think it's still a fairly new concept in Canada, much like naloxone is still a fairly new concept despite widespread use just south of us.
Okay, thank you, Michael. Well, I'm not seeing any hands raised for questions, nor is there anything in the question box at this time. So I think then that we will close today's...
Oh, sorry, Kim. Anthony's had a question emailed to him, so Anthony, I'll turn it over to you.
Yeah, so I'll read the question. The question is, what will the ramifications be locally within Waterloo Region going forward if no policy is introduced? For example, what do you predict the trends will be from a numbers perspective? It's a great question, and it's part of the reason why I think we're excited about some of these potential policy options. We have a trend that's consistently said for the last number of years that accidental overdoses are the third leading cause of death, accidental death in Ontario and Waterloo Region as well, and within our LHIN. So I think it's likely that trend will stay the same if we don't do some sort of intervention. But there is really an opportunity here. When we look at Good Samaritan laws, what we see is that targeting that type of an intervention can lower the threshold to accessing emergency services during an overdose emergency. The other benefit, though, of this is that we have a population that is traditionally hard to reach and very hard to serve. And the literature suggests that if we can lower the threshold to calling 911, we may actually forge the path to improved healthcare outcomes in the long term and improved access to resources. So as we say in the report, ultimately and most importantly, lives can be saved by these types of policy interventions.
Okay, thank you, Anthony. Any other questions coming your way that we're not able to see for some reason, Michael, Anthony, or Kayla? Okay. Well, fascinating subject with lots of implications federally and some real challenges locally to making things more accessible. So thank you for that. All right. Well, what I would like to do is just to again thank you for your time today, and to invite you to come and share the invitation to our webinar that's going to be happening tomorrow, which is the Smart Response from a Canadian Municipality. And we'll have Shane Turner and Gloria McNeil speaking about their experiences with the City of Kitchener. So that's tomorrow at 2 o'clock. And before we go, Michael, maybe I'll just ask you to speak to the film that's now available online.
Sure. It's a great film. It's been nominated for an Oscar, the People's Choice, all the usual awards, of course. And I encourage you to check it out while it's still free and before it hits the theater run. It's about 7 minutes long. It's called Eyes Wide Open. It's on our website. It's pretty interesting. It's getting good traction in the circles that we'd kind of hoped it would get traction in poison control circles, in the medical community, and beyond, and not just within Canada, but across the continental U.S. And farther flung places. So I would encourage you to take a look, and if you think it's if it's hot stuff, then share it. There's really nothing in it for us. We don't take a percentage of the proceeds because there are no proceeds, but we hope it opens doors to this wider discussion of saving lives and preventing harm. We know the tools that'll work, and it's really just a question of stepping up. And just related to Kim's point about Good Samaritan legislation or overdose via naloxone, my general advice would be don't wait for higher orders of government or higher order systems to get behind it. If communities had waited in Canada for naloxone programs, a few that do exist, well, they'd still be waiting. So there's lots of that you can do in your own community or by joining with other communities across Canada. But if we wait for the higher levels, I mean, they're typically slow to react, right? And I would encourage you to get involved and talk to your neighbor about this kind of stuff. So I also point out we're doing a second film, and that'll be released in about 6 weeks. It's more geared towards first responders. It speaks to some of the 911 issues and overdose prevention, including naloxone. So look for it on YouTube.
All right, thank you, Michael. And also, again, thank you, Kayla, and thank you, Anthony, for sharing your expertise and your study results today. We certainly appreciate that. For our audience, you can view the whole webinar in its entirety. We'll be posting that on www.preventingcrime.ca along with the other webinars that have been completed to date. So again, thank you for your time today, and we hope that you'll join us for the remainder of the series, and you can find that again on that same website. All right, over and out for us, and thanks, and have a great day.